Dr. Molly Brinkman. I'm a small animal veterinarian near Nashville, Tennessee, and this is a show for people who love their pets, like to laugh, and realize that life is hard, but dogs and cats help. I love veterinary medicine. I'm probably already obsessed with your pet, and I want you to understand more about both of those things. Welcome to the Dr. Molly Says podcast. Hello, everybody. I am excited for this episode because we're talking about a subject and an issue that I love to talk about. I love to see in practice, which if you're a veterinarian or a vet tech listening to this, you might be surprised by that because a lot of people in vet med grumble when they hear they're going to be managing a patient with this. So before we get to the topic for this week, I did have a couple of follow-up questions from last week that I wanted to talk about. So we're going to do this instead of our hot take for this week. So the episode last week was on choosing pet food for dogs and cats. We talked about dogs a lot, which is the case so far. And there was a lot of chatter about that episode, lots of comments under the clips from that episode, a lot of varied opinions, which I was not surprised about. But there are also plenty of follow-up questions. So it is not the last time we're going to talk about pet food and nutrition. I'm going to have guests on who are experts in nutrition and animal nutrition, which I am not. We're going to have some guests from the pet food industry to help understand better how all of that works. So I'm excited to talk more about that. It's another thing I like to talk about. But I did want to answer a couple of great follow-up questions. So this person sent a question and asked, they said, I'm wondering if there is more info on why to choose whole foods over kibble other than it just makes sense. I agree that intuitively it makes sense, but would love to know more about the why so I can decide if it's right for my pet. He's doing well on a prescription GI diet, so I'm hesitant to mess with it unless there is a compelling reason. Any research showing benefits of switching from kibble to fresh? Any studies comparing them? Thanks. I love this question. It's a great question. It's a valid question. So first of all, if this person's pet is on a prescription GI diet, so they have a medical condition, some type of GI issue that has been well managed on a prescription GI diet, which I assume is a kibble, I would absolutely not change that. I would not recommend changing that. Now, if an owner came to me and said, I want to switch to a fresh whole diet for my dog who's on this prescription GI diet, I would say, okay, great. If that's what you want to do, I would absolutely refer them to a boarded veterinary nutrition service. So boarded veterinary nutritionists who will work with that client to develop a diet that will also continue to help with those GI issues. There's a lot of very specific parameters and accommodations that they'll want to make for that. They'll want to know what they're eating and why it works. And so a dog like that, I wouldn't switch unless we're not doing well on the prescription kibble GI diets. But then I would definitely go to a nutritionist to consult on how to switch and what to switch to. The question on why we should be thinking about fresh diets over kibble is great. There is not a ton of research comparing the two, and that's just because it hasn't happened yet. I do think that because there's a growing push for this in the public sector and in the scientific veterinary community, I think more research will continue to emerge. There is research in human studies about variety in diet contributing to better gut health. I do think microbiome of the gut is extremely important, and I don't just think that. Research does prove that. There's more and more emerging evidence that probiotics and variety in what the gut sees can help with overall gut health, which does have a lot to do with other parts of the body and their health. So I think there is emerging evidence for it. We don't have a ton of concrete evidence, though, but there is evidence that certain types of whole fresh foods can contribute to certain health benefits. So like I said in the episode, I feel that fresh diets are a great idea. And I think that anytime we can add some variety and fresh toppers, different foods have different benefits. Some of those benefits can be lost when food is processed into a kibble. I'm not saying there's anything wrong with processing and kibble. I'm not saying we're losing core necessary nutrients and ingredients, but I do think some of that is also a benefit to feeding whole, fresh, cooked foods. So I hope that makes sense. I am very optimistic about growing research and evidence to support that, but we should just cook the food. I do think we should still just cook the fresh food. Okay, that's the first question. The next question, follow up from last week's food episode. And this is going to count as our hot take because it's a great question. And I very briefly talked about this in the episode. Hi, Dr. Molly. I'm a vintage LVT, 30-year plus. So she's been a veterinary technician, a licensed vet tech for 30 plus years. She knows what she's doing. I'm just telling you right now, or he. I follow you on all the socials and now love listening to your podcast. My question is about something you said in your recent podcast on pet diets. What is the reason for not putting an asymptomatic pet on an RX prescription urinary diet if crystals are found in a routine UA? I would have thought the diet would be an important step in preventing those crystals from becoming stones or in preventing a potential blockage in cats. Do you think that an OTC urinary health diet could be just as effective? Or are there other steps that pet parents should take? Okay, love this question because it's actually a soapbox of my friend, Dr. Klein, who is a boarded veterinary nutritionist. I've asked her about this before, and so we've talked about this. And she will preach till the cows come home. And this is based in lots of fact and science and research, and others will agree with her, specialists, that when we see patients who are asymptomatic for urinary disease, so they don't have a problem, like this tech said, we just are doing a routine urinalysis, maybe with wellness blood work or something, and we see struvite crystals in particular, which are one of the most common crystals we'll see in urine. Struvite crystals can grow in urine that does not have an infection. They can grow in completely normal patients. They can be a normal finding, an incidental finding in these patients. And it is extremely rare for struvite crystals to become bladder stones in the absence of an infection in the bladder, of a bacterial infection in the bladder. So I learned from Dr. Klein that it is incorrect most of the time to put a patient, or anytime a patient is asymptomatic, you just happen to find struvite crystals in their otherwise normal urine. It is incorrect for a vet to automatically put them on a urinary diet. Those diets are intended to dissolve stones or prevent them in patients who we know are developing bladder stones. And so what we should be focusing on in patients with struvite crystals is making sure they don't have an infection, make sure there's not a sneaky infection. If you're worried about it, the patient is symptomatic at all, what we should be doing more so is looking for an infection. So maybe culture the urine if there's no bacteria in the urine on a regular urinalysis. But really what I was saying, someone was asking about, are prescription diets always necessary? And they have a very important place. And if your vet recommends it, it's probably needed. But I do see this. I will see patients who have been put on a urinary diet simply because a vet saw struvite crystals in their urine on a routine urinalysis and they were not ill. They did not have any urinary symptoms. Even if they do have urinary symptoms, that can be a separate issue from the struvite crystals, and the diet isn't necessarily going to fix that because it's more likely, in a dog at least, that they have an infection. So I hope that makes sense, but that's why I mentioned that. If we're going to chat with Dr. Klein in the future, and so we can have her talk about it more because she is the expert. But it's a great question, and the answer is that no, we should not be putting dogs with struvite crystals on routine urinalyses that don't have symptoms of anything on urinary diets automatically. We should be looking for infection and just treat the infection. Okay, that's the hot take today. Thank you for those questions. I hope everybody is doing good. I didn't ramble yet, but I worked today. It's a Monday, and it was a very busy day at work. And one of my clients was like, it's just being a Monday, isn't it? And I'm like, yeah, it's always a Monday on Monday. we were just very busy. And then I had a very sad euthanasia at the end of the day. And there were preteens crying on my shoulder. And it was very sad. Not to be depressing on the podcast, but it was a very long day. But I'm excited to be here talking to you all because we are going to talk about allergies. And I posted a question box about allergies on my story yesterday morning, I think it was, and just said, hey, we're going to talk about allergies on the podcast. What questions do you have? And y'all sent me about 500 questions about allergies. The funny thing is most of the questions were the same. My dog is chewing their feet. What should I do? Apoquel is expensive. What should I do? Should I send this saliva test that I got in the mail? Should I trust it? So it was about 5 questions over and over and over again. But what it told me, and I already knew this, is that allergies are a huge issue, especially in dogs. Lots of our dogs have allergy issues, and we're frustrated about it as pet owners. And so I just want to preface this by saying, and this is what I say to my clients in the exam room, managing allergies in our patients is frustrating. It's frustrating for your vet. It's frustrating for you as a pet owner. And I can only imagine it's frustrating for your dog because they're gnawing their feet off and they don't understand why they itch so bad. And that's frustrating for them too. So we all recognize that allergies can be very frustrating. And something else I also explain to my clients is that I try very hard to take time the first time I discuss allergy management with a client to really explain what's happening when our dogs, we're going to mostly talk about dogs in this episode. We're going to have multiple episodes about allergies. So we're going to focus on dogs today, but it's important for pet owners, dog owners to really understand what is happening with their dogs who have allergies, because understanding that whole sort of big picture will help you as a pet owner understand why we're doing what we're doing. I think it can help build some patience with the process because it can be a process, and it definitely helps with communication down the road for your veterinarian if you understand what they're talking about. So I'm going to explain to you what I explain to my clients, but in even more detail. So allergies can be categorized in dogs and cats, but we're going to talk about dogs in basically 2 main categories first, all right? So there are environmental allergies and there are food allergies in dogs. And these are 2 important categories because so many times I will hear clients say, oh, my dog is itchy. I think they're allergic to chicken, is what the first thing a lot of people say. So they think their dog has a food allergy, and that's fair. And we're going to talk about chicken and the protein we feed our dogs with allergies. But research shows that of all the dogs that are allergic to something, up to 90% of them have environmental allergies. And so the numbers are like 80 to 90% of dogs with allergies have environmental, not necessarily food allergies. Some of these dogs, there's some overlap. They can have some of both. But dogs who have true food allergies are only about 10 to 20% of any dogs that have allergies. And that means that only about 1% of all dog population has a true food allergy. So does that happen? Absolutely. There are dogs that truly just have a food allergy, but more likely if you have an itchy dog and we think they have allergies, it's probably environmental, or it's at least going to be part of their allergy problem. So that's a really important thing to understand. It's a big misconception. Most dogs that are itchy with allergies have environmental allergies. So we do see, I will say this, there were some questions about my vet told me that my dog can't have allergies because they're having symptoms less than 2 years old. I don't really know where that myth comes from. Dogs can definitely develop environmental allergies as young as like a year old. That's less common, but it definitely happens. Dogs with food allergies can definitely develop those symptoms even younger. I definitely have diagnosed puppies with a food intolerance or allergy. So that's another somewhat kind of nuanced distinction. Okay, so We're going to focus on environmental allergies because, like I said, most of our allergic dogs are environmental, but we're going to talk about food a little bit while we're talking about environmental allergies. So dogs who have environmental allergies, their body is having a hypersensitivity to antigens, which are allergens in the environment. So I tell people grass, dust, pollen from trees and plants. These are the environmental triggers. They're not all of them, but a lot of them that cause this hypersensitive reaction in some dogs. So these dogs have an immune system that overreacts to these allergens. And we think about in people, for us, when we have these environmental allergies, we call it hay fever. We get this raging rhinitis, runny noses. We can get itchy, watery eyes. That's what people do when they're allergic to these environmental allergens. In dogs, they react at the level of their skin more commonly. So what's happening in dogs who have environmental allergies, their body comes into contact with these antigens, which is the word for the allergen, the trigger, okay? So by inhaling or touching these allergens, dust, pollen, grass, whatever, when it comes in contact with the dog or the dog inhales it, that sets off this inflammatory cascade. The immune system recognizes that allergen. And in dogs who have environmental allergies, they have an overreaction to it. There's a cascade of all this cellular mechanism. There are interleukins that bind to things. It's a very complicated cascade. And all of these things get released within the immune system. And then I always tell people it's the allergy cascade. So all these inflammatory cells and signal cells are getting released and going down the chain, and it ends up at the level of the skin. So certain cells bind to other cells. And finally, what happens is the immune system remembers those allergens, and when they come into contact with them, they activate mast cells. And mast cells release histamine. They release prostaglandins and cytokines. And all of these cells are what are creating this itch. They're what are creating inflammation at the surface of the skin. And so that's why in dogs with allergies, most commonly, we're going to see a variety of symptoms, but they're pretty consistent. So dogs with allergies will lick and chew their feet. And this is one of the symptoms of allergies that a lot of humans don't actually think and realize, oh, this is a sign that my dog itches. So dogs get itchy because of this reaction, and they lick and chew their feet. And they can do it any time of the day. Sometimes they do a lot at night. A lot of times they'll do it more when they come inside from being in around all those allergens. We'll start to see what we call lick staining. So if you have a dog that does this, you'll see that their toes, the hair and the skin around their toes can turn this brassy, kind of coppery color. That's lick staining from their saliva. They can get general inflammation in other parts of their skin. A lot of dogs will have chronic red inflamed skin in their groin area, their armpit area. They can get inflammation in their ears, and they'll get secondary ear infections. Sometimes we see dogs who have inflammation around their eyes. That's another, in their muzzle, so their face. And then they also will get irritation around their butts. So we'll have anal irritation. And so dogs will lick and chew all of those locations. They'll also scratch with their feet. So we can see a variety of these symptoms with these environmental allergies. And so some dogs have all of those symptoms. Some dogs will literally just lick their feet. I saw a dog today. That's literally all he's doing, but he is incessantly licking his feet, and he has such lick staining. His feet are like the color of this chair. Some dogs will just get chronic recurrent ear infections, which we're going to talk about. And some dogs have anal gland issues because of it. And then some dogs over time, if this is allowed to go on over and over again, we start to get chronic changes. So all of this inflammation, all these changes on the surface of the skin lead to secondary problems. And this is another really important thing to understand, because I do see patients who probably have underlying environmental allergies, but they get secondary skin infections. So you'll see dogs who have these round sometimes they're red, sometimes they look flaky. They can have this sort of yellow scabby cast on them. And we call those epidermal collarettes. And they can be all over the skin. And a lot of times they're in the inguinal groin area, the lower abdomen. And those are a sign of a secondary superficial skin infection, which we call pyoderma. And we try to test that in our clinic. So do a cytology of the skin to look at it. Is it bacteria? What's there? But they get these very superficial bacterial skin infections, which is secondary to that underlying allergy and inflammation. And I will see patients who have just been treated for these secondary skin infections over and over again. So I'll see a dog who's been on cephalexin or some other type of antibiotic every other month for 3 years. And these dogs have chronically irritated, thickened, hyperpigmented, so their skin will start to turn dark. And these are the allergy cases that are really hard to treat when it's been going on for a long time. And all that's been done is treatment of the secondary problems. So they've had ear infections treated over and over again, superficial skin infections treated over and over again. They may have been on steroids here and there to help treat the inflammation, which works really well temporarily. And so these are the dogs that we see that have had chronic allergies with secondary issues. And unfortunately, sometimes they've just been treated for the secondary issues. So it's why it's really important that we know about allergies and we know that they're the primary reason for a lot of these things. I'm getting ahead of myself, but so that's what happens when your dog is exposed, when your dog is hypersensitive to these environmental allergens. They have a reaction at the surface of their skin. They get itchy. That leads to infections. They can have overgrowth of yeast on the surface of their skin. Between their toes is a big place at the base of their toenails. A lot of these dogs do get ear infections. So they have inflammation in their ear canals, but what is overgrown in their ear a lot of the time is yeast actually, and not bacteria, which is why it's so important that we do test those ears. When your vet says, I'm going to do an ear cytology, I know sometimes it's oh, can you just treat the ear infection? But this is why it's best that they offer or perform this cytology, because if we're seeing ear infections over and over again, and it's always just because of a yeast overgrowth, most of the time, that is telling me as a vet that the underlying reason for this dog's chronic yeast ear infections is probably some type of allergy, most likely environmental. And until we tackle that underlying reason for the secondary infections, they're just going to keep happening. And they're a lot of times going to get worse. The ear canals are going to get stenotic and start to get more narrow. And then we're going to start having also bacterial infections, and it can become a big mess. So ear infections, skin infections, itchy feet, irritated face, itchy butt. That's what we're going to see most commonly with these allergy dogs. This is also why when I talk to clients about what's so important for managing these dogs is really helping to improve their skin barrier, because their skin is the level at which their immune system is reacting to these things. And so the more healthy we can make their skin and the more robust we can make the barrier of the skin, the better they are equipped to deal with their exposure to these allergens. So I hope that makes sense. So what I do when I see patients who look like they have allergies, there's a lot of things I'm going to talk to the owner about. One of the first things we always want to make sure in an itchy dog is, are they on flea prevention? And this is because dogs can also have a flea allergy. Some dogs are more sensitive to fleas and flea bites than others. And even sometimes dogs who are on flea prevention, if they're exposed to fleas, they can still have a reaction if there are fleas in their environment. So this is important to know. But if you have a dog who's itchy and they're not on flea prevention, that's one of the first things we're going to talk about doing, because we want to rule out an allergy to fleas, because that's a really easy thing to treat and prevent, right? So flea allergy dermatitis is a big issue that we see when pets are not on flea prevention. These dogs often will have a reaction to those flea bites and dermatitis in a more specific region. So over where the tail meets the body, the lower trunk over their back is an area where we'll see a lot of redness and pustules. They'll be chewing back there. You'll see dogs, they gnaw at their skin. And so we're always going to look for fleas, look for signs of fleas, flea dirt, and we're going to ask you, is your dog on flea prevention? But that's why. And if they're not on a very good, effective flea prevention, we're definitely going to recommend that we do that. Okay, so that's number one. We want to rule out a flea allergy. Number two, I definitely talk about food when I talk to my allergy patients. I ask, what are we eating? Have we been eating this? What is in that food? How long have we been on this? Have we changed diets? What we feed our dogs who have even environmental allergies can exacerbate the inflammation that is contributing to the allergies and the secondary problems. And I do believe that there are certain foods that can maybe help counteract that inflammation or help decrease inflammation. And so this, for some reason in the veterinary community, this can be a controversial thing to say. It really shouldn't be. There's research to support this. But when I am talking to a client about their dog who probably has environmental allergies, I sort of talk to them about a multimodal approach to managing that. So one way I will talk to clients about managing allergies is maybe think about trying a different type of food if we've been on like a kibble that's chicken or beef or other poultry based. So I'll try to put them on an alternative protein source. If I'm going to do that, I like to put them on a food that has salmon as the main protein source. I do find in my personal experience, and there is research to back this up, that salmon-based diets can have some anti-inflammatory properties. And because it's, for a lot of dogs, a novel protein, a new protein that they haven't seen, it can decrease some sensitivity. And so a lot of people think, oh, most dogs are allergic to chicken. They're probably not actually allergic to chicken, but there is thought that chicken, beef, turkey, poultry can be a pro-inflammatory protein in these dogs that are hypersensitive. So that's one thing that I'll talk to clients about before we go to a diet trial, which I'm going to talk about in a minute with a prescription food. I will talk to them about potentially trying an alternative protein. And if we're going to do that, I like salmon. And there are over-the-counter diets that are marketed as limited ingredient diets. No, these are not as perfect of a limited ingredient diet as prescription diets, but a lot of clients don't want to go through the cost of a prescription diet right away. And I think that's totally fair. And so we'll talk about either a kibble or canned food that is salmon-based, or we can also talk about fresh diets, like I talked about last week, sometimes that are a novel protein. So lamb or a salmon or something like that. So food is one thing I talk about with my clients. Now, if I am suspicious of a food allergy, that's a completely different conversation, because that is such a small percentage of these dogs, where I personally am typically gonna target my treatment at fixing the secondary problems and focusing on a more likely environmental allergy. When those treatment methods don't work, if a dog's not responding to those, that's when I definitely start to think about, is there an actual food allergy here? And the way we test for that and potentially treat it is putting those dogs on a prescription diet or sending them to a veterinary nutritionist to do an elimination diet. So typically clients want to go for a prescription diet. It's a hydrolyzed food. What hydrolyzed diets are, they're prescription foods. The protein in that kibble is hydrolyzed, so it's broken down so that the immune system in the gut doesn't react to it. And so hydrolyzed diets can be used for an elimination diet trial. So we put those patients on that hydrolyzed diet for 8 to 12 weeks. And if their symptoms resolve, then we sometimes will challenge that, try something else. If their symptoms return, then we know it worked and we keep them on it. I don't always challenge those patients, because if their symptoms resolve on that food and that's really the main thing we've done, a lot of times clients just want to stick with that, and I'm fine with it. Some food allergy dogs will have GI symptoms. Some of them will have vomiting and diarrhea. And so that can be a helpful clue that maybe this is a food problem, not necessarily an environmental problem. Okay, so that's when we sort of turn and go towards food allergies. But when we're focusing on environmental allergies first, like I told you, I'm usually going to talk to them about novel protein diet or a fish-based limited ingredient diet. A lot of times they want to do that over the counter. There are some other prescription diets that can be helpful with the skin. Skin Topic is another one that Royal Canin makes that can be very helpful in these dogs. So we definitely talk about prescription options. So often I change the diet. The other things that I'm going to do for these patients, we have some great medications in the clinic that can help control the itch and some of the inflammation with these allergies and can help prevent these secondary infections and problems. And a lot of you had questions about these medications, and we're going to dive in and talk about them. Before I talk about those medications, I'm just going to cover the other things I will do for these allergy dogs besides these pharmaceuticals that we have at our disposal. So like I said, food change happens a lot of the time. Something else that I will do is I will put these dogs on an omega supplementation. So fish oil is a great source for that. So omegas have been shown to have a lot of benefits. Fish oil has a lot of benefits for the skin, for skin barrier. It can have benefits for joints as well. I use fish oil a lot. I recommend it a lot. And there is science that tells us the skin barrier can be improved in dogs who are on fish oil. So I often will talk to owners about doing that. There are a lot of options out in the world of fish oils to give. You want to find a company who has a fish oil supplement that has high concentration of DHA and EPA, and then you also want to have an NASC seal on that product to make sure the quality of the supplement is good, and you want to pay attention to where they're sourcing that fish oil. So in our clinic, we carry Veterinary Recommended Solution product. That's an omega supplement. I really also like Farah fish oil supplement, but there's a lot of others. So there's a lot of options. Ask your veterinarian what a good source of fish oil is, but I put these dogs on fish oil a lot of the time. Another thing that I'll do, which again, some people in the vet world find controversial. This shouldn't be controversial, but probiotics. So we know there is growing evidence, and it will continue to grow. It just hasn't been researched a ton yet, that gut health, there is a gut-skin axis. There is benefit to a lot of systems of the body when the gut is healthier. And there are certain probiotics that can really help with all of those things. And so I do talk to my clients about probiotic supplementation. We want to, again, select a high quality probiotic. We know what it is. We know it's one that works. This is another thing that I will tell clients. This is just another thing in our bag that we can do to try to help manage these allergies. And then the other thing that is not a pharmaceutical from me, but it's an over-the-counter. I do have clients who want to try an antihistamine when their dogs have environmental allergies. And it's fine. Their research shows that probably only like 20 to 30% of dogs respond to antihistamines with allergies, so they actually help. It's a small percentage. There is very low risk in trying an antihistamine in a dog for a couple of weeks, and so I definitely have clients try. I usually go with Zyrtec because it's only given once a day. It usually doesn't make dogs drowsy, and so that is something else that I'll offer to clients as something tangible that they can do. I do try to impress upon my clients that an antihistamine is alone, it's not going to fix your dog's allergies. I tell people, unless they have a food allergy, a food change is probably not going to fix your dog's allergies alone. Putting them on an omega supplementation, not going to fix their allergies alone. I stress upon my clients or impress upon them that multimodal approach is the way to go. And I definitely have clients sometimes who are like, well, I tried this for a while, and then I tried that for a while, and then I tried that for a while, and they never did it all at the same time. And In some diseases, we do want to try things one at a time. But with dogs, with my patients that have environmental allergies, I definitely tell people we want to try at least a couple of these things all at the same time and see how they work together because they're doing different things, right? We're supporting the skin barrier. We're preventing some inflammation, blocking histamine release with the antihistamine. So they're all doing different things that are part of this very, very broad and complicated allergy cascade and response. Okay, so those are the sort of non-at-the-clinic pharmaceuticals. Let's get into the nitty-gritty of medications that we use. Almost every GP vet practice is going to have in their clinic. If you know about dogs with allergies, you've probably heard of these things. I had so many questions about them. Apoquel, Cytopoint, Cytopoint, Apoquel. Do we give them? Is there a cheaper way? What are they doing? Okay, so Apoquel is a pill. Cytopoint is an injection. These are two completely different medications. They both have to do with IL-31. This is a cytokine that's part of that allergy cascade, but it's what signals the itchiness, okay, that has to do with allergies. So it basically tells the brain this is itchy. And so these medications are decreasing IL-31 activity. They're just doing it in different ways. So Apoquel is a pill. It's given twice a day. When you first start giving it, we typically give it twice a day for 2 weeks, and then we decrease to once a day. And what Apoquel does is it's a JAK1 inhibitor. So it's blocking JAK1, which is an enzyme, and that is what signals the IL-31. So it's like blocking the signal for it. And then Cytopoint, which is an injection that we give every few weeks. It's a little different in every dog how often they need it, but as often as every month. And that is basically binding IL-31. Okay, so they're both reducing the activity of IL-31, which signals itch. And Apoquel, the pill, works very fast. We think it starts working within 4 hours, so it's going to relieve some of the itching very quickly. The benefit of Cytopoint is that it is an injection, so it can last for a few weeks, and you're not giving a medication all the time. It does take longer for it to kick in, but you don't have to give a pill every day. There are, just like any medication, there are possible side effects with both of them. There are less possible side effects with the Cytopoint injections. Apoquel is a bit of it's not controversial, but there are some kind of conspiracy theories about Apoquel out there. If you Google it, I always tell clients, the first time we talk about Apoquel, if you Google it, you might read some scary things. There are some studies done on Apoquel that suggest that maybe dogs who are taking Apoquel long-term are more likely to develop certain types of cancers than other dogs. And there are listed side effects. When I have patients on Apoquel, we are definitely monitoring blood work on those patients once a year. We're watching their liver values, making sure everything still looks okay. If they develop certain types of cancers, we're probably not going to continue giving Apoquel. So there are definitely possible side effects. No veterinarian will deny that. I do try not to keep patients on Apoquel long term if I don't have to. I will often put a patient with allergies and client wants to try these medications. I'll put them on Apoquel first as a trial to see if it works well, see if reducing that IL-31 activity works. If it helps the dog tremendously, then a lot of the times I'm going to switch them to Cytopoint injections, see if that works just as well, and we'll maintain them with Cytopoint long term because if a dog doesn't react to the injection of Cytopoint, they're usually not going to have really side effects from it. It's possible. I've given Cytopoint to tens of thousands of patients, and I've never had an issue with it personally. So those are the two big pharmaceuticals that we have. There is a new JAK inhibitor on the market. It's called Zenrelia. It's new to the market. So same class of drug as Apoquel. And I have definitely had some patients who haven't responded well to Apoquel and or Cytopoint, and I have switched them to Zenrelia, and I'm seeing some great success in those patients. I know some of my friends who are dermatologists in the social media space are talking about it because they're seeing the same. So I'm very encouraged by having Zenrelia now on the market. And there's chatter about Zenrelia as well. Definitely a whole thing we could talk about there, and I'm happy to. But so those are the kind of big pharmaceuticals we have right now easily at our disposal. We have a lot of patients on Apoquel. We have a lot of patients on Cytopoint in our clinic. Our tech appointments, any given day, we're going to be giving multiple Cytopoint injections. So what I tell people with Cytopoint is once we start Cytopoint, a lot of clients will go ahead and they're like, man, forget the pills. I just want to start with the injection and see if it works. So we will start it right away if that's what they want to do. If we get a good response, especially after 2 injections, I do explain to people that there can be a sort of a cumulative effect of Cytopoint. So the way I say it to my clients is don't give up on Cytopoint until you've given it twice, 2 times in a row, because I do sometimes see an even better response with the second injection. And I usually do that about a month after if we don't get complete resolution of our itching and chewing and all of that. So Cytopoint can be given as often as every month or so. I definitely have some patients who can go 8 or 10 weeks before they need it again. Another important thing about these patients with environmental allergies is they can be seasonal. A lot of them are seasonal. So there are a lot of dogs who only have these symptoms of allergies in the spring or the fall, or some of them in the winter. So they can be seasonal. And so I do have some patients who just need a few Cytopoint injections every year. Their owners have figured out when their allergy season is. They do Cytopoint as soon as it starts. We keep going until they just don't get itchy anymore. And then they don't have to have Cytopoint for a few months. So those clients, those owners do get lucky because they don't actually need to pay for these medications all year round. And that's nice. I do find that there are some patients who end up on Cytopoint and Apoquel. A few people asked about that in the question box. Is it okay? And the short answer is yes, it's okay. There are definitely some patients who do well on both of those medications. Again, they're doing the same sort of thing, but in different ways. And so sometimes they work well together. I do tell clients if I have a patient who ends up on both of those medications, we've done a diet trial with a hydrolyzed food, or another prescription diet for skin, and we've tried all these other things, and we're on Apoquel and Cytopoint, and we still don't have complete resolution of our symptoms. At that point, we're going to talk about other potential treatments, other immune modulators, and we're definitely already talking about going to a dermatologist, which we're going to cover in a second. So those are the things that we have at our disposal. We definitely use antibiotics to treat secondary skin infections and ear infections. Now, for me personally, I treat most of my secondary superficial pyodermas in my allergy dogs with topical treatment. This is another thing that can drive me a little crazy. A lot of these dogs do not need oral antibiotics. They can get better with topical mousses and shampoos. Topical treatment can often treat these superficial pyodermas. We also take great care when they have these skin lesions to, like I said, do skin cytologies, make sure it's bacteria, see if there's yeast, make sure we don't have something else going on. We want to make sure we're free of parasites, ectoparasites, and these ear infections. These dogs get ear infections over and over and over again. And again, a lot of times it is yeast, and we treat those based on what we see on cytology. But I do, again, see patients who haven't had ear cytologies. They've just been treated with the same ear meds over and over again. We don't actually know what's going on because then they can develop into these secondary bacterial infections. Another question somebody asked in the question box about treatment of allergies. Someone asked, is it safe to use steroids long-term? And I'm glad that this person asked that question because this is something else we can see in dogs with chronic allergies. Sometimes they've been prescribed steroids and they end up on steroids for a very long time. And there aren't a lot of patients where that's absolutely necessary. There are 100% a lot of side effects of keeping dogs on steroids like prednisone. And it can affect the immune system in general. And dogs who are on higher doses of prednisone for a long time can become actually cushingoid. It can actually cause disease. And we'll see secondary effects of the steroids. And so do I use steroids in my allergy patients? Absolutely. I use oral steroids a lot for ear infections. I use them to help get that inflammation down. while we're treating the ear. If I have patients who have really inflamed skin for one reason or another, secondary to allergies, I will definitely use steroids to kind of calm the fire, calm down the inflammation. I'm using lower doses of steroids. I'm using anti-inflammatory or half of an anti-inflammatory dose. I am using them for short courses. I'm tapering them off very quickly. So if you have a dog who has allergies and they've been on steroids only or a lot of steroids for a long time, I would really chat with your vet about an alternative to that. If they're not on Apoquel or Cytopoint, definitely something you're going to want to talk about. And you may want to go visit a veterinary dermatologist to talk to them about how to manage those allergies. So I didn't want to forget to answer that question because we do see that long-term steroids, in most cases, dogs with allergies, not the best option if we haven't tried a lot of other things. Something else we'll see in these dogs as a secondary problem, which I mentioned, is yeast overgrowth. So Malassezia yeast, and this type of yeast that can be overgrown on areas of the skin, in the ears, toes, it can be very itchy, the presence of that yeast. And this is something that we need to treat. It's a secondary problem, but it needs to be treated a lot of the time. And so it's very common for these dogs, especially with chronic allergies that aren't treated, to end up on an antifungal oral medication. Ketoconazole is one that's used very commonly. So that is something that you also shouldn't be surprised about if your vet talks to you about. They should be doing some type of cytology to determine the presence of that yeast. You really can't rely on smell, even though yeast can have a smell. We really need to visually see that yeast in order to start those medications. But that's something else you may find your dog on when you're dealing with chronic allergies. Something else I talk to clients about, and this is something that as later on in my career, I've gotten better about, and that's talking to clients about the option to go to a veterinary dermatologist in a dog or a cat with allergies early on. Previously in my career, I sort of saved that as a last resort, and it can be, especially if a client has cost concerns. But even with cost concerns, it's important to know that you as a pet owner do have the option to be referred to a veterinary dermatologist to get help on how best to manage these really complicated issues, which can be primary allergies and secondary issues. Veterinary dermatologists are really great doctors. They get to really focus on a smaller subset of issues, and they're very, very good at it. They know more than your GP vet does about allergies. They know more about fixing the skin. And while we as GP vets are very equipped to manage a lot of dogs with allergies, I try to make sure that my clients know I'm always happy to send you to a dermatologist, because one thing dermatologists can do that we don't do in our practice is immunotherapy. So just or very similar to people, dermatologists can do skin allergy testing. They have other forms of allergy testing. They can determine what the actual allergens for your dog are, and they can create immunotherapy. So oral or injectable therapy, like allergy shots in people, that helps desensitize them to those things, so that can help manage their allergy. The expectation I set for my clients, if I do send them to a dermatologist to talk about immunotherapy, is not that it's going to completely resolve their allergies and secondary problems forever, but can definitely help. In some patients, it does resolve their allergies, but it can help reduce the need we have for other medications like Apoquel and Cytopoint. It can take several months for that immunotherapy to be completed and help. And so, I set people up for the expectation that it's not necessarily going to be cheap and it's not going to be a quick fix, but it's always a good idea and never wrong to go to a veterinary dermatologist to at least get a consult on what's the best thing to do for my dog's allergies and help me figure out exactly what is going on. So when speaking of allergy testing, this is also something someone asked about, and it was about allergy testing. So blood testing for allergies and hair and saliva testing for allergies. So one thing that is a soapbox for me is that blood tests for food allergies in particular are not accurate. So there are some that can be maybe a little bit more accurate than others, but overwhelmingly, food allergy testing by blood, hair, saliva is not accurate. Most of the time, you are absolutely wasting your money and you're paying sometimes a couple $100s just to be very confused. At our practice, we did have a fill-in vet that would send off this blood panel for food allergies sometimes. And it was really hard to talk to clients after that because they would have this idea in their head that their dog is allergic to XYZ and they're frustrated because they've cut all of these ingredients out of their pet's diet and they're still having all these symptoms of allergies. And it's hard to have to say, that's because that test wasn't accurate. And we know that they're not accurate because they've been tested. There are studies that show they are not accurate at all. We can put the links to those studies in the notes of this episode if you're curious about that. But trust me when I tell you, most of those are not accurate. With environmental allergies, we can see some more accuracy with those tests. But what I tell people is if you're going to go to the length of having your dog tested for allergies, I would highly recommend that you just go to a veterinary dermatologist. Let them recommend the best way to do that so that one, we know that the results are as accurate as possible, and two, we can actually do something helpful with that information. Because if a client comes to me and they say, hey, I took my dog's saliva and I sent it out to this company and here's what it came back as they're allergic to, that does not change anything that I'm going to recommend to that client. So it's something as a pet owner to really know, right now, we don't have really evidence that most of those tests are very accurate. And so you're probably just wasting your money. I think I've covered what I wanted to cover in this episode. It's a lot of what I tell my clients in the exam room. This is mostly the spiel that I give. I don't spend this much time talking to clients about it because I literally can't. I have an email that I send them. But I know that this is frustrating. If you're a pet owner listening to this and you have a dog who you've been struggling with allergies for a long, long time, I feel for you. I don't have a dog with allergies. I see lots of dogs with allergies every single day. There are a lot of breeds that get allergies. Any dog can have allergies. We see a lot of labs with environmental allergies. We see a lot of golden retrievers, lots of Frenchies, lots of doodles. I see a lot of little terriers. A lot of pitties have allergies. There's just a lot of dogs that have environmental allergies and secondary skin issues. So you're not alone. Lots of y'all listening to this can relate to everything that I'm saying. The big take-home points I would want pet owners to get from this is one, why are dogs, what are they doing when they have these environmental allergies? Most dogs have environmental, not food allergies. There are a lot of different things that can be tried. The medications that we use in the clinic can be a great option. Multimodal therapy is really important. Chronic issues because of allergies a lot of times are either because the secondary problems are not being managed appropriately, or we haven't actually addressed the underlying primary problem, which is the allergy. And also that it's just really frustrating, and you can always go to a vet dermatologist, because if you have a dog with complicated and chronic and really difficult allergies, your best bet at fixing them is usually going to a vet dermatologist, especially if you have a vet who's done all the things that I just talked about. They've done everything right. Sometimes they just get to the end of their rope, and patience is important. And if I didn't mention it, I do want to make sure I do say that hydrolyzed diet trials are definitely something that I will use when I am working through an allergic patient. We've tried other things. We've tried maybe a novel protein, but an over-the-counter diet. We're doing other medications, Apoquel and or Cytopoint, doing all those things. We're not getting full resolution. I will absolutely put those dogs on a hydrolyzed diet trial. I will offer it early on. A lot of the time, clients don't want to pay for a hydrolyzed diet before we've tried the other things, which is totally fair. I do have a patient. He's one of my favorite allergy patients. He had chronic, horrible, terrible skin. I saw him for the first time. He had seen a bunch of other doctors, and his skin, it was horrible. He had terrible yeast overgrowth. He had secondary superficial pyoderma bacterial infection. So we treated him he was on ketoconazole for like 2 months. He was on Cytopoint and Apoquel. He had been on all these things. We were treating everything, but he just wasn't getting better. So when I took over, we continued those things, but we did a hydrolyzed diet trial. And I'm telling you, a hydrolyzed prescription diet fixed that dog. His skin cleared up within like 10 weeks. It's like amazing the difference that diet made. So I'm the first person that will tell you some of these dogs probably have environmental and food allergies, and hydrolyzed diets can really help. And other prescription diets that are just geared towards helping with skin barrier, like Skin Topic from Royal Canin, can also be very, very helpful. So it's another thing to talk to your vet about. If you want to go straight to a prescription diet, don't try the over-the-counter, fish-based, whatever. Absolutely, do a prescription diet. They can be very, very helpful. They just cost more, but that's okay. They're going to cost less over time if they prevent you from being at the vet every 3 weeks with a skin infection. Okay. That's my allergy spiel for now. I have a couple questions I'm going to answer from the question box. There were like 5,000, but I'm going to answer a couple of them. And then we're going to talk about this again sometime, and we're going to have a vet dermatologist on so we can talk about more. Okay, I kind of have answered these, but Buttercup Cat Lady said pros and cons of trying allergy testing and shots on an 11-year-old dog. So I would say the pros of allergy testing and shots, meaning immunotherapy, usually with a veterinary dermatologist or a GP vet that knows how to do that. The pros would be that can have a long-term success. So it takes a while for it to really take full effect, but we can get some long-term success. We can decrease the amount of Apoquel, Cytopoint, other medications that we need. Cons would be there is a significant cost usually involved. It isn't always 100% effective. So again, I make sure people know this doesn't mean we're never going to need Apoquel or Cytopoint, but it can absolutely reduce the need of it. And there are some patients who don't respond a lot to immunotherapy, and that's just a risk we take when we try it, but we just a lot of times don't know until we try it. Okay, another question. Brioni Page said, best med for itchy ears. And again, something I've already talked about, but a great thing to reiterate. If your dog has recurrent ear infections, number one, your vet should be testing their ears with swabs under the microscope, ear cytologies, to find out what's causing their ear infections, not just treating it, testing it to know what they're treating. And if that is a lot of yeast over and over and over again, they're just getting recurrent ear infections, usually because of underlying allergies. And so itchy ears are a lot of times secondary to allergies. We have to treat those ear infections. We have to treat them appropriately. We have to treat what's actually there. And we have to treat the underlying allergy. And like I said, I do put a lot of my ear infection patients, when they're real inflamed, on steroids. That helps with the inflammation, the irritation, sometimes the itchiness there. But I do a low dose, I do a tapering dose, and we treat the ear infection, but we absolutely focus on also trying to treat the underlying allergy. Okay, I've rambled for an hour, I think, about allergies. I hope this is helpful. I'm not a veterinary dermatologist, but I am a GP vet, and I see dogs with allergies every single day that I work. And I think there's a lot of misconceptions out there about what dogs are allergic to and what is good to do for them. So I hope, again, this helps you sort of wade through some of that noise. We are going to do more episodes on it. Feel free to send me follow-up questions from this episode. You can DM me, Dr. Molly Says. You can DM us on the podcast page, Dr. Molly Says Pod. You can also, in the link at the top of our page, you can see a place to submit questions. You can also ask us random questions about anything to do with your dog or your cat or veterinary medicine. I hope you enjoyed this episode of the Dr. Molly Says podcast. You can listen to us, download episodes, follow us on all of your podcast providers. You can also follow us on YouTube and watch the episode there. Make sure you're following me, Dr. Molly Says, and the podcast page, Dr. Molly Says Pod. And I will see you next week on the Dr. Molly Says podcast.